Welcome to our conversation today about how to partner with your primary care provider to really be strong advocates for your own health. So as you think about your relationships with your primary care provider, your doctors, your nurse practitioner, or physician's assistant, how do you feel about that? How do you feel like you can best partner with them?
I always like to do my own research before I go in. I'll have a list of questions and I just keep it in my phone and bring it up and make sure that I'm touching on everyone, because sometimes in the moment, it just flies out the window and you forget what you wanted to talk about, so it can really help keep you on track.
Jennifer, I know that you recently had to find a new doctor too.
I wanted to find a doctor like mine who had retired. And, you can search on the internet, and I read the bios, and it does have their kind of interview. But that's on paper, so I still went to my appointment and let her know, this is what I had in my previous doctor. This is what I'm looking for. I just like that she is flexible with me. She, is very encouraging. She believes in me.
Really having that relationship where they understand you as an individual, what motivates you, what's challenging for you, and then figuring out the options. And, as a doctor, I want to make sure, all the patients out there know, you should expect this of your doctor.
Right.
This shouldn't be oh, I'm so lucky that this happened. No, this should be the norm.
Yeah.
And that, if you're not getting that, then keep looking. And again, sometimes you just don't have those options. What advice do you have for that? You've probably been in some of those situations before too.
I think it's something Heidi said earlier about doing some research. I know that there are a lot of great websites out there that can help you. If you're going in to talk about this, here's some basic questions to ask your doctor when you go in to see them, just about your own preventive care. Here's your checklist for preventive care that you should be looking at. So that can still be scary because, I was raised that the doctor is the expert and you do not question the expert.
I think it's also a little bit of a change of mindset because in my mind, I think we are people. I also think my doctor works for me. So, which he does. But he does have this body of expertise, right? But I'm an expert on myself. Exactly. And so we need to work together because he knows things I don't, I know things he doesn't. He can't practice medicine without me.
That is absolutely true. And it is such a partnership, which I think, when I think about, Brenda, what you said, growing up, the doctor kind of knows all of it and everything. I think there's also been a shift in how we expect these relationships to be. And that it is entirely reasonable to expect that as a partnership. And more, there's this conversation about shared decision making. It isn't about me as a doctor saying, you must do this. It is really, how do we arrive at the right decisions for you in the moment that's going to be most effective? I think you said something really important. I think finding the right doctor is as much about knowing about the doctor as knowing about yourself. I think the better you know yourself and what helps you, especially in difficult circumstances, major decision making, and then you're like, okay, this is what I need. This is the kind of counsel that I need.
Right.
Then you put it out there. And you could even literally say it to the doctor, even the first time you meet them, as a patient, this is how I think about things, how I make decisions. How do you feel about that? With just one question. I think how they answer it could tell you all a lot. If you're hearing those things that feel right to you, then I would follow your instinct. And the other part is there's, how you just meet people and you click with them?
Yep. Absolutely.
Trust that gut. There's something you're responding to. And the flip side is true. It's I don't know. I don't know if I can really talk to this person about things. That's not going to help you. Which means when you do have that really serious thing, you're going to wonder, well, do I talk to them or not? That's not a question you should have to wonder about your primary care provider.
Right.
It really shouldn't be.
Yeah. Well, I think, too, it is there's a reverence for the medical profession as a whole. And the fact that there is a body of knowledge that is a mystery to most of us.
And I would say that it's the doctor's responsibility to unravel that mystery. Right? Because this is about you, this is about your body, this is about your health. So the more you understand it, the better decisions you can make for yourself. Because ultimately, you are responsible for making those decisions.
Right.
And so in my role as a doctor, my goal is to make sure that you can make as informed a decision as possible. I think the other part that's really key too is, if you're getting an explanation from a doctor and it's not making any sense, ask them to explain it again a different way. Right.
Dr. Young, I want to put you on the spot.
Go for it.
How do you find a primary care doctor? Because you are a provider.
What I start with is people that I know that approach their own personal care similar in philosophy to the way I do. So, I will want to go to, I will talk with people that, really value that shared decision making, that will take the time to listen. Everybody has their unique circumstance where I want somebody who can relate to me within those factors that are important to me.
Right.
And then I go and I meet them. And if it doesn't match what I'm seeing online and what their credentials are and what they say they are, if that gut level sense isn't right, then that's not where I go. My health has to be number one. So kind of, what advice do you have?
I want to have a doctor that I feel comfortable referring my friends to, that they would go and say, oh, yeah, this is a good doctor. Thank you for referring.
Somebody who will listen to you.
Don't be afraid to ask questions.
Yeah, someone that you trust.
I would say definitely, expect that the relationship with your doctor is one that should be full of trust and one that you can have shared decision making. Yeah. Well, thank you all for this conversation today about really advocating for your own healthcare and how to really partner with your primary care provider.